Emma's Universe podcast.
Where do we go from here? Where do we go from here?
Emma's Universe podcast.
Where do we go from here? Where do we go from here?
Emma's Universe podcast.
Hello and welcome to Emma's podcast. Yes, it's Wednesday talk. So this week let's talk about a little bit of AI. Let's have a little fun with AI and maybe, by listening what AI can do, people are not getting all freaky. So today we're going to be talking about AI in healthcare and transforming medicine and improving lives. Artificial intelligence is also revolutionizing healthcare, we know that, offering a promising new solution for diagnosis. It is needed, actually. Treatment and patient care, from AI-driven diagnosis tool to personalized medicine. AI is making a significant impact in helping healthcare professionals provide better care and improving patient outcomes. And one of the most noticeable application of AI is healthcare is in medicine, imaging and diagnostics. Yes, imaging and diagnostic, especially the imaging, because if you're looking at X-rays and you're looking at other imaging tools they're utilizing, the better they're accurate, the better it is to see the image, to see, like when you do an ultrasound. Even now they came up with when they do the baby ultrasound, they come with the face and everything. It's like, oh, okay, this is the face of the kid, okay. But these came up with AI. So those are all powered by AI, powered by algorithm. It's always algorithm. This is how it works. So it's now capable of analyzing images, medical images such as X-rays, MRIs, and CT scans, with a level of precision that match or even exceed that of human radiologists, which is a good thing because, let's say, we in our lives can be busy, and if we're not focused sometime with radiologists or people doing some of the readings, then we can miss out. Example, you want an example? Okay, I'm going to give you an example. Many years ago, when I was a kid, yes, I was a kid once upon a time, we went, that was what, during a holiday, that was a springtime somewhere over the rainbow. We used to ride bicycle a lot, and when we were doing miles and miles and miles, and then my mommy dearest, and my other two sisters, we went for a bike ride. And as we were getting, I will always remember, as we were getting along, we were joking with the little one, we were laughing, joking, blah blah blah, and we end up a fork in the road. And I turned around and we stopped, and I stopped to goof around actually at that time. And we did not know which way we were supposed to go. So what I did, I was full speed. I stopped, I hit the brakes, and I flew over the bar handles, and I basically broke both of my wrists. Okay. So at that time, we went to the hospital as emergency. We get 2 X-rays. The technician realized that, first of all, I could not even lift up any one of my hands. But the doctor decided that I only have one broken wrist. So I had a cast from above the elbow down to my hand. Problem is, in that story, I couldn't move the other one. I couldn't do anything with it either. But the doctor decided that I did not have it broken. However, the technician noticed that, and I was the nurse, or the technician or the nurse, either way, talked to my mom on the side and said, she has the other one too. It's broken. I did both. I know. Because it's got to be me. So we had to stop at the doctor, at our regular doctor, at like 9 o'clock at night, got the x rays, look at it, and he had to do a cast, which this one was shorter. Actually, it was below the elbow. So I had two casts, okay? So this is the kind of situation that when somebody doesn't read things properly, this is what happened. You got issue happening. Well, I can guarantee that the doctor we had knew the top dog at that hospital, and the other one got himself in trouble for that. So the what is great is that AI system can detect anomalies such as tumor fractures. Here we go, and this is like cancer at early age when treatment is most likely to be successful. This is what we're looking at AI. It's being able to help. How can we put AI in motion at work, in what are the positive benefits, what are the pain points, and what are the benefits. The benefits is we want people healthy. We want to be able to, when illness come along, be able to diagnose the earliest possible, because sometimes when we notice things are not going around, or especially for tumors, some are not detectable by x-rays, some are from MRI or CT scan, are not as visible, so the human eyes will not realize that. However, by training AI, by really doing that, then it can detect this earlier. That is an advantage for the survival of that person, or the treatment, or the length of the treatment, because it can be extremely challenging when you have to go through the process, especially when it's cut later on. So the ability of AI to process and analyze vast amount of data quickly allows for faster diagnosis. This is what we're looking at the end. Reducing wait times for patients and improving the overall efficiency of healthcare system. Imagine that you're going to the MRI. You have to lay down there. You have to wait hours on end from the time you begin to the time they gave you, if they gave it to you the same day, which they should be giving to you, some of the result, that will cut the time at least, to be conservative, half. It should be even faster than that, because it can analyze this at the speed of light. So that can help and really improve the system with less possibility of errors. The percentage of errors will be minimal. So in addition to imaging, AI is also transforming the field of predictive analytics. Machine learning models are being trained to predict patient outcome based on historical data. Now, that doesn't mean they're going to tell you the future on this one, but it has a percentage of looking at patterns in reoccurring issue, including medical records, lab results, and even lifestyle factors. So, by analyzing data, AI can help identify patients at risk for conditions like heart disease, diabetes, or stroke. It can enable doctors to intervene earlier and provide preventing care instead of, fill you up with happy pills. Do you imagine that if we can have the preventing care, how much the life of people would be better than popping pills left and right like it's M&Ms? AI can even predict the likelihood of complication during surgeries, allowing for more informed decision making and reducing risks. Yes, by knowing what patterns could arise. So that's not bad at all. AI is also making strides in personalized medicine, where treatment are tailored to the individual characteristics of each patient by analyzing genetic information, lifestyle factor, and medical history. However, I'm going to put a big however on this one. If the person is not truthful, yeah, that kind of put a dent into that story. But if the person is truthful to their doctors and they got the right information, that definitely can give a profile and help and can assist in creating personalized treatment plans that are more effective than one size fits all. Because right now, in most cases, one size fits all is what people do. In most cases. Okay? So don't say, oh, it might use 100%. No, I say in most cases. for a particular patient based on their genetic profile, helping to reduce the trial and errors approach that have traditionally been used in chemotherapy. That can be used especially for oncology to determine which cancer treatment would be the most effective. Do you imagine this for a minute? That based on your genetics, based on what you've got, the person and the treatment would be more effective? That is unbelievable. And the likelihood to respond to the medication or the protocol will be absolutely a win-win situation. So why not to reduce trials and error approach that has traditionally been used in chemotherapy? So why not? AI are also being used to develop new drugs, with AI-driven platform being used to screen millions of compounds that identify potential candidates for treatment. So why not being able to do that and to identify the potential candidates for treatment? Why not? You know, we have some time to rely on technology to get us where we need to be. Now, is it 100% correct? No. Do we need to make a lot of improvement in this regard? Absolutely. It's a work in progress. It's like everything else. But what a big jump could it be if we start to do this? Seriously. So, if we improve patient care by enabling better management of chronic condition, then powered by apps and wearable devices can monitor patient vital signs, detect changes in their health, and alert doctors if intervention is needed. Well, we can see this when you have a pacemaker. The pacemaker will record everything and send stuff to your doctor, so we know when you got a problem with your heart, when you had to had what do you call it, when your heart is not functioning properly, in order to reset the heartbeat to be working in harmonious, or in harmony, should I say, not in harmonious, but in harmony, then it will jolt you a little zap on you just for the heart, and this is recorded. So if we have this, and I don't say everybody should be, plugging something in their body for being checked, but think about it for people who are high risk, and being able to have their vital monitored. And if you're at risk, then having AI communicating and help you, that will make your life easier. So that's one of the biggest things too. But despite, all of those benefits, AI in healthcare, there is also the challenging and the concern. The most pressing issue is ensuring the privacy and security of patient data. This is again something that needs to be looked at, because when you're looking at AI, which is great having AI, but what are the security? What are the protocol to protect the privacy of people and the security of patient data? Because you don't want this to be leaked. We got enough leaking information, from credit card to patient information to anything people can link. Healthcare system increasingly rely on AI in big data. The risk of data breach and misuse of personal information becomes more significant, which is true. There is also the challenge of ensuring that AI systems are free from bias. That's another thing too. Since AI algorithms are trained on historical data, there is the potential for them to inherit biases that may affect decision making, particularly in area of like race, gender, and socioeconomic status. But like I said, also when people are lying, not telling you the truth about their own health, if you lie, then you have a higher potential of not having the right medication or diagnosis based on what you're providing to AI, because AI is not going to know what's true and what's not. So that's another thing too. But nevertheless, the future of AI in healthcare looks incredibly promising. With continued advancement in machine learning, AI could play a crucial role in addressing global healthcare challenges, from improved access to care in underserved areas, which will be nice, to tackling emerging disease as AI continue to evolve. It will likely serve as an indispensable tool for healthcare providers, enhancing their ability to deliver timely, accurately, and personalized care, which is so true. If people going to see the doctor provide the right information, AI gathering that information, figure it out, detecting earlier what's not working, what is the problem, what is the disease, and being able to tailor perfectly accordingly to the body, to that person, what a miracle it would be. Think about it. That's what is so fascinating. You know, we can look on at TV on the Star Treks and everything because they used to do the diagnosis by their scanners, and they had it, and it's like, oh, yes, this, it needs that. And they were doing the treatment like the same way with their devices. You know, we're not far from it. We're already starting it, but it's going to take a while to do that. But one of the things we need to make sure is, again, the security of data. Data breach is something that's so big. But it's the accuracy of the data. If the person lies, again, if you fill out something via AI is not going to know if it's true or not. And that's one of the biggest things as well. So we have to be determined to really open ourselves up and looking at the bigger picture, which I know is scary for some people, especially when you're talking about AI. But if it can provide the diagnosis earlier, and you have an MRI and it detects something, even a micron, then somebody is not going to see it, man, and it can save your life from a brain tumor that is not noticeable into the MRI, but AI is going to notice it and pinpoint and bring it in. Man, it's going to save a lot of people's lives. So why not? There is so much possibilities with AI. But again, the worried people have, which I agree if it's not used right. But being able to utilize this as a support will make a huge difference for generation to come. So that's something we need to look at and not seeing it as the enemy. Again, like I said in our Monday talks about AI, it's a possibility to do something that is life-breaking, changing, that will really emphasize everything and really move things up to a level that we have never seen, and how much groundbreaking we can do in regards of healthcare and innovation. It is amazing. Robotic has been helping a lot because robotic are building devices, and I'm thinking about the stents actually. How precise it is when you have a machine doing the same thing over and over into the micron. You have to adjust and calibrate the machine. However, the precision on doing things and on doing the same thing over and over and over is so precise that you have little chance of discarding some of the devices, and your production is way stronger. So yeah, think about it. I think it's an awesome tool to do and to have, not to do, but to have. You can do too because you're developing actually the AI, but utilizing and simplify some of the tasks and helping healthcare provider, helping to the people as well, the patients at the end of the day. So I think it's pretty good to say that it could have a wonderful future if we are allowed to do it in the right direction and monitoring it to make sure that, again, there is no breach of security, there is no, again, data based on consensus of where you live, what is your race, your age, or whatever the deal is. It should not be counting when it comes down to AI and being fair to everyone. So this was our podcast for today. I know it's interesting. I love AI. It's very, very, very interesting. And a lot of people need to hear more about AI because and understand how it's being utilized. So the fear of it should not be as much as people have. Changes are inevitable, and we're here to change, evolve, and change, and evolve, and change. That's what we do. So our technology. So all my love, guys, and we'll talk to you later. Bye now.
Where do we go from here?
Emma's Universe Podcast.
Where do we go from here? Where do we go from here?
podcast. Universe podcast.
Studio Stargazer.